Hey guys, welcome to Taping 101. Today we're going to be working on taping the shin for the pathology known as shin splints, or what you guys should be calling it, medial tibial stress syndrome. There are two different ways to tape the tibia or the shin. I will be showing you way number one, and then eventually I'll show you trick number two. So there are a few things that must happen with your patient before starting this tape job. Number one, you either have to have a roll of tape, or what we call is a pressure block. That roll of tape is going to go underneath the calcaneus. So we're going to place that roll of tape right underneath the calcaneus. What that does is it actually causes a contraction of the gastroc muscles, which is what we want in this tape job. We're going to be doing a lot of circular motions about the tibia, and those circular motions certainly will compress the gastroc and cause your patient to suffer from cramps. So applying this roll of tape to the bottom of the heel prevents the cramping that might occur if we hadn't. So with that said, there are two different ways to tape the shin. The first way is using a circular motion. Now, importantly enough, what we know is that medial tibial stress syndrome is caused by typically the tibialis posterior pulling away from the tibia. So one way to kind of reduce the pain that the patient is experiencing is to do those kind of C-clamps across the tibia. So what we're going to do with this tape job is start on what is called the tibial crest, or the most central portion of the limb. And so we're going to start just about 2 finger widths above that malleolus, unless of course the pain is lower. So we're going to start here, and we're going to be pulling from a lateral to a medial position. And the goal of this is, again, to pull that tibialis posterior back across and make it nice and comfortable on its tibial position. So as we move proximally, we want to make sure that our C-clamps are half lapped, right? Kind of the common theme across all tape jobs. If you half lap your tape jobs, then they always look a lot prettier. So pulling from lateral to medial, and we're going to do this until we get to the most distal portion of the gastroc. Once you're done with your tape job, there are two things we could do here. The first thing that we could do is just leave it and let our patients go back to participation. But what clinical experience has taught me is that our patients will start to sweat and the tape will start to peel away. So one way to avoid that is to use this stretchy tape here. Many of you have gotten this kind of tape if you've ever given blood. They use this tape to wrap the cotton to your arm. So what you're going to do with this tape is just like you started, start distally and literally just work your way up. And it may look like I'm pulling really tight, but I promise you I'm not. Again, it's just to hold the tape on the leg while they're participating.